Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
It's Lindsay Smith-Rogers. 20 years ago, the HPV vaccine was introduced with the hope that it would prevent cancer. Today, 2 decades of evidence show what a powerful public health tool it has become, preventing HPV infections and reducing the risk of HPV-related cancers, such as cervical cancer, around the world. Liz Szabo, a veteran health journalist, spoke with Stephanie Desmon about the vaccine's remarkable success, the work still ahead, and why we cannot take this progress for granted. Let's listen. Liz Szabo, thanks so much for joining me.
Thanks for inviting me.
So I want to talk to you about the work that you've been doing reflecting on the HPV vaccine at 20. 20 years ago, the HPV vaccine was introduced with the promise that it could prevent cancer. 20 years later, we're no longer talking about what we hoped it would do, and we can measure what actually happened. So why is this moment so important?
It's important because we now have 2 vaccines that prevent cancer. The hepatitis B vaccine prevents hepatitis B-related liver cancer, and the HPV vaccine does a very good job at preventing cervical cancer. And there's early evidence that it also is likely to prevent many other cancers. HPV causes a total of 6 cancers. So there's some preliminary data showing that the vaccine, in addition to reducing cervical cancer rates by 80%, also prevents precancerous lesions in the vagina and vulva, and also cancers in men. It was a study that looked at all HPV-related cancers in men, which could be anything from esophageal cancer, head and neck cancer, anal cancer, penile cancer, and they found that men and boys who were vaccinated had a 48% lower risk, so it's almost 50% lower in male-related cancers. So it's just incredibly exciting to have more ways to prevent cancer.
So as journalists, you're trained to cover things that happen, right? Like a new study, a disease outbreak, a breakthrough treatment, but prevention is different. And so its biggest successes are often the things that never happen. And so I was wondering if this reporting changed the way you think about how we tell public health stories.
Well, in this series, we really tried to focus on human beings so that people would know that the HPV vaccine is important. You still will hear people say, oh, well, it's a newer vaccine. I don't want my daughter or granddaughter to get one of these new vaccines. Okay, it's 20 years old. It's older than your granddaughter. It's older than your daughter. So we interviewed 2 women who were not eligible for the HPV vaccine when it came out, and they got cervical cancer, one at 25 and the other around 30, 31, and it cost them their fertility. And they just talked about, even though they survived, it was a really difficult treatment. I interviewed someone with head and neck cancer who also went through very difficult treatment. He said, I'd never heard of HPV before. He likes to say something I'd never heard of almost killed me. So I think it's really important for people to know the cost of not taking the vaccine. People will often talk about, what are the risks of a vaccine? The risks of the HPV vaccine are really low. Sore arm. Some teenage girls might get a little dizzy if they don't sit down long enough afterward. But what are the risks of not taking it? So we really wanted to focus on the stories of people with cancer, both people who survived and people who passed away and who died from cervical cancer.
And in telling their stories, what are you hoping that your readers will come away with?
I hope people will have a respect for science and how the data are really, really encouraging about this vaccine. I mean, an 80% drop in cervical cancer cases. And England reported recently that they actually recorded no deaths among women 20 to 24 from cervical cancer for the first time. Now, granted, cancer is not very common in women that young, but they had big drops in cancer deaths in women, even in their 30s. It was like a 63% drop. So we have pretty good data that this vaccine prevents cancer, emerging and strong data that the vaccine does actually save lives. And I think that's important for people to know so they can make an informed choice. There's so much misinformation out there, but the data on HPV, I don't want to sound like a cheerleader. I don't own stock in any of these companies. companies, but it really just keeps getting better and better. There's data to suggest the vaccines actually create herd immunity, which is when the vaccination rate is so high that the rate of the virus in circulation actually falls. So there's just not very much virus out there because no one's spreading it. So because of that, people who are unvaccinated actually get protection. And there's data showing that these vaccines are protecting unvaccinated people as well and having an effect not just on men or women who got the vaccine, but on their whole generation. To see the cervical cancer rates just disappearing in this younger generation of women, it's pretty remarkable.
I remember when the vaccine first came out, there were controversies about it. Would you walk us through those?
Yeah, I think the vaccine companies tried to do some advance work with religious leaders because there was some concern and continues to be some concern among parents that if kids don't have to worry about sexually transmitted diseases, and that is the way that HPV primarily spreads through sexual intimate contact, that it would encourage them to go ahead and have sex as if, I don't have to worry about HPV and now it's a free-for-all. And of course, kids still have to worry about things like pregnancy and AIDS and herpes. So the vaccine only really removed one risk. There's no data to show that kids who were vaccinated are more likely to have sex. In fact, the generation of vaccinated people having less sex and teen pregnancy are actually down, which is a good thing. On a population basis, there is no data to indicate at all after 20 good solid years of data now. There's no data at all to show that getting the vaccine makes kids decide they can have sex without consequences.
And yet it's a vaccine. And so because it's a vaccine, there are people who are preventing their children from getting this protection, which you've just shown is sort of an extraordinary protection. So how did we get here?
Well, there's a tremendous amount of misinformation, and there are people who benefit from that misinformation, benefit because it makes them famous or powerful, or they become an influencer on social media and they get followers, or because their organization gets money and members. I think that's a problem. And COVID made a lot of people leery of vaccines in general. One bit of real bad news about the HPV vaccine is that there is misinformation and fear of it. Overall, the vaccination rates in the U.S. are okay. About 78% of teens have gotten at least one shot. So one dose of cervical cancer vaccine seems to be effective. We're not sure about the other cancers. In terms of getting the full series, kids need 2 to 3 doses depending on the age at which they're vaccinated. The earlier they're vaccinated, the fewer doses they need. Then it's only 2/3 of kids have completed the full series. So we're doing okay, but we could do a lot better. What really saddened me was writing a story about a woman who lost her sister to cervical cancer. And most of the time when I interview people who have survived cancer or their family members who love them, they'll tell me their story. And at the end of the interview, the survivor or their family member urges all of my readers to either get a vaccine, get a mammogram, do something to prevent this cancer. And I interviewed a woman who was 17, 20 years ago when the vaccine came out, and she was vaccinated, and she's lived a full and happy life. She's got 4 sons. Her sister was a little older. Her sister was 21 and had already tested positive for HPV. So she did not get the vaccine. She went on to die of cervical cancer at 33. And it's really poignant to think of these 2 sisters, one who just missed the benefit of the vaccine. If it had come out a few years earlier, she might be here. And what was really sad is when at the end of the interview, I asked this woman who I have to say is absolutely distraught about her sister's death, even years later. It's been something like 8 years, and she was still crying during our interview. So this woman was distraught over the death of her sister. And I said, so do you plan to vaccinate your 4 boys? And she said, well, I am pro-vaccine, but my husband is not. And during the pandemic, he became very anti all vaccines. So he just will not allow their kids to have any new vaccine, any additional vaccines. So not HPV, not Tdap boosters, not meningitis, not flu shots or COVID shots. So this woman has to tell her sons, and she said, I just have to hope that when they turn 18, they'll make the right decision and say, this is the vaccine that could have saved your Aunt Erica. And that to me was just gutting. I'm sorry I'm spoiling it for your readers who haven't read the story already, but it was just like a punch to the gut to hear this woman absolutely would vaccinate her kids if she could, but she doesn't want to go around her husband's back, she said. that this man saw his sister-in-law die and waste away, this incredibly vibrant, wonderful cancer advocate, a mother, and to see her sicken and die for lack of a vaccine, and then to say no vaccine for my kids, that really kind of blew me away, because I think the conventional wisdom in the public health community that I heard for a long time was that when these diseases come back, people will change their mind. Even Jenny McCarthy has said, well, it may take some of these diseases coming back for people to want to vaccinate their kids. And people said that about COVID. They said, well, people don't want the vaccine, but wait until someone they know dies from COVID. And we saw lots of people who lost children or parents from COVID who still were against the vaccine. So I think that is the one piece of news that is really not encouraging about HPV, that someone can be so powerfully against the vaccine, even knowing exactly and having experienced firsthand a death, that still won't motivate them to protect the people they love. I did not expect that. And so that gave me a new understanding of how powerful the anti-vaccine sentiments are and how much of a challenge people face when they are trying to eradicate this cancer.
Now, HPV vaccine is a success story in high-income countries, but it's a different story elsewhere. Can you talk about that a bit?
The WHO has endorsed giving kids 1 dose of the vaccine because that is the most economical way for countries to do this. And I think 114 countries now have HPV vaccination, but it's obviously a lot harder, even if you only need to give kids 1 shot, to vaccinate kids in a low-income country. So although the WHO estimates high-income countries like the United States will eliminate cervical cancer by 2048, and there's some countries like Australia that say they're on track to eliminate it by 2035, that lower and middle-income countries may take much longer. So there may be a high number of cervical cancer deaths and suffering even into the second half of this century in low and middle-income countries, which is unfortunate. As we all know, there's been a huge loss of funding to worldwide vaccination efforts in the past couple of years. So that loss of funding will definitely make it harder to save the next generation of kids.
So if another reporter is telling this story 20 years from now, what do you hope they'll be writing?
Oh gosh, I hope they'll be writing that cervical cancer has been eliminated in the United States. That would be wonderful. I hope I live long enough to see that. I would love to see women not have to suffer this way. I would really love to have data over the next 20 years showing how HPV vaccines affects the other vaccine-preventable cancers that HPV causes. HPV causes cervical cancer, as we know, but cervical cancer is no longer the leading HPV-related cancer in the United States. Head and neck cancer now causes more cancers and deaths than cervical cancer does. And the thing about head and neck cancers, in the past, they were mostly caused by smoking and drinking, and now they're mostly caused by HPV. And there's no real prevention strategy for these cancers. They tend to develop in hard-to-see places like the tonsils or the back of the throat or the very base of the tongue. There's no way you can go into your doctor and have him or her screen you the way women can go in every few years and get screened for cervical cancer. There's no early intervention. So these cancers are often diagnosed at stage 3 or 4. And although they are more curable than, say, a smoking-related cancer, the treatment can be really rough. So what I would love over the next 20 years is to see good data that these vaccines also prevent head and neck cancer and to have really conclusive data that they prevent all of these cancers.
Is it because girls were first targeted for this vaccine that there's still an issue with head and neck cancer? Or is it because when you have vaccines and a really good way to screen for it, that's when you have the real action?
The bulk of head and neck cancers occur in men, and that was true when smoking was the leading cause, but it's still true now that HPV has become the leading cause, and it's thought that HPV can spread through oral sex as well. So I think the thinking, and I'm not a doctor, is that women tend to be first exposed to HPV having vaginal intercourse, and so they are exposed to the virus in the cervical area, and their immune system does keep it in check. For men, they may be first exposed to the virus through oral sex, and that is why it can develop in the throat and the back of the mouth. And sexual habits have changed over the years, so it's thought that may be contributing to the increase in HPV-related oral cancer. And of course, the vaccine wasn't available to boys until 2011. So it's really too soon to see on a population level rates of head and neck cancer go down because of that vaccine. These are slow-growing cancers that tend to be diagnosed around age 64. So I think we're going to have to wait, maybe another 20 years to get definitive data to really see a vaccine effect for head and neck cancer the way we've seen it for cervical cancer. Although there was a study looking at HPV-related cancers in men that did find 50% lower risk among vaccinated men for all of those cancers together. I would love to see people spared. I've interviewed hundreds of cancer patients in my career, in my 25 years covering medicine. And surgery and chemotherapy and radiation can be devastating and really difficult. I would love to see no more people need to go through that. So that's what I'm hoping that we'll see progress in all 6 of these cancers.
Liz Szabo, thank you so much for joining me.
Thank you for having me.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, Stephanie Desmon, and Rachel Walsh. Audio production by Michael Bonfils, Matthew Martin, and Philip Porter, with support from J.B. Arbogast, Spencer Greer, and Chip Hickey. Distribution and social media by Rachel Walsh, with support from Nick Moran and Brianna Iacovelli. Follow us on Instagram and Blue Sky at Public Health Pod for more public health takes and special content. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.